Hey everyone, Dr. Preston Hansen, iDentity Oral Surgery. Today I wanted to answer a question about how can dental implants fail? What would cause a dental implant to fail? It's not a fun discussion, but I do have it on occasion when I get patients referred to me with trouble, who have trouble with a dental implant that they've had placed sometime in the past. Dental implants are wildly successful. They're very successful when done right, when proper planning has been used and the surgery's been done well and an appropriate period of time for healing has taken place, and then ongoing maintenance has taken place. They really are. When you follow all those rules, it's in the high 90% success rate for something. And the length of time that they can, live in your mouth is a lot longer than any other dental thing we can do usually. So for your investment, there's definitely something we strongly believe in. But as more and more dental implants get placed, statistically, we just have started to see more implant, complications or troubles with them. Now, frequently, let's see, that's a good place to cut, but I just got to come up with my next thought for a second. Let's see. Okay. Now, the most common problem I'll see with dental implants comes down to planning and the surgery. And a dental implant, unlike a tooth, needs a little bit more bone to survive in. So dental implant is placed into your jawbone and acts as an anchor, but the area has to be prepared first, and that frequently will involve bone grafting if needed. Teeth, on the other hand, they can survive in very little bone. Teeth have a blood supply around them. They're natural. They can live in very little bone. Dental implants aren't like that. They actually do need a little bit more of a foundation in order to support the implant over the life of its service in your mouth, because the mouth is it's a tough environment. A lot of chewing, there's bacteria in all of our mouths. There's nothing we can do about that. And so planning and surgery and ensuring that there's good bone as a foundation to begin with, that's probably the number one reason that dental implants will fail, is when one of those things is one of those things gets ignored and the planning isn't done right. Afterwards, maintenance comes into it heavily. So a lot of people may have the idea that, if you just place a dental implant, it can't get cavities, I don't ever have to take care of this thing again, which is not entirely true. So dental implants, they don't get cavities. They can't, because there's no natural structure. They're made of titanium and then porcelain for the crown. But the same bacteria that causes plaque in and around your gums, the same bacteria that would cause gum disease or cause gum recession or bone loss around teeth, that same bacteria can affect a dental implant and cause bone loss around an implant. And usually bone loss around an implant proceeds a lot quicker than bone loss around a natural tooth. So if you're having any trouble with an implant, whether you're having what feels like infection maybe in and around the gums or pain, it's definitely something not to wait on. You want to get it checked out right away, because frequently there are things we can do to halt that, but if not, we would want to intervene before we lose too much bone, because regrowing bone is probably one of the hardest things we do. We do it all the time, and we have great ways to overcome those problems, but it's a big problem. So lastly is just occlusion. A dental implant, once it heals, once the crown is on, it should be a wonderful thing that works for patients. But if we're biting too hard on it, if we're grinding on it, over time, overloading the forces on our teeth can cause the implant to fail. And same thing to happen. We don't want to lose bone, because it's hard to come back from that. So that's some brief things. I'll probably go into more detail about specific cases and specific problems that can affect implants. But because I do so many implants, I have a really good handle on helping implants that are in trouble. So hopefully you're not watching because you have some implant trouble, but if you do, please reach out to me and let me help you out. It's definitely something I do all the time. So give us a call and set up a consultation. I'd love to meet with you. Thanks.